Now, the coronavirus pandemic has infected over 100,000 individuals and has led to the deaths of more than 1,000 persons in Nigeria. The second wave of the virus has proven to be more deadly and spreading more rapidly than before. The new strains identified in several countries and imported to others, including Nigeria, remains a major concern, with health authorities insisting that abiding by safety protocols is a sure way of curbing community transmission. Joining me via Skype from the UK is clinical pharmacist Adaku Efuribe. Good morning, Adaku. Thank you for joining us on TVC Breakfast.
Good morning.
Now, the government has been speaking about safety protocols, and it also has been talking about the fact that a lot of Nigerians have been refusing to take responsibility for their safety. And especially when it comes to ensuring social distance and observing all of the protocols like we mentioned. And there are concerns that this is really the reason why we are facing issues with community spread. And if we are to tackle it from your point of view as a clinical pharmacist, what more can people do now? Let's start from the point of view of people at ensuring that they take responsibility first, and also we'll move on to government measures.
I think the Nigeria Center for Disease Control has been on this thing for a very long time, and they've really done a lot of work. They've even released, infection prevention and control handbook for home use. But a lot of Nigerians are still not following the preventive measure protocol. On one hand, church leaders have observed most church functions. People do wear their masks and they practice social distancing. On the other hand, some churches and other religious bodies have not imbibed this as well. And when we go to our open market, people cannot obey social distancing in Nigerian local markets. That is just the truth. But I see people without their masks as well. So it just has to do with more public health enlightenment in the language that people can understand. In as much as we have this handbook, we have the government agencies, the Ministry of Health working so hard about this. But people in the villages, people that don't even understand English, we need to interpret these things to them. And it has to be our responsibility. Even corporate bodies, they have to put things in place, and they have to, it just has to be a case of no mask nuisance. We just have to enforce these things and be serious about it, because I see a lot of people moving around without their masks and without using their hand sanitizers. And this is spreading the virus again during the second wave.
Now, you spoke about enforcement, and the government has come up with a 6-month jail term for persons who do not observe the protocols. And for some persons reacting to this, there are talks about the fact that our correctional centers are not in the right state as it should be, and that we'll get overcrowding, and so we begin to see another spread, what we are trying to prevent happening again in the correctional centers. I want you to perhaps talk to us more beyond a 6-month jail term. What more do you think that the government can do to ensure that people adhere and look into how we could enforce?
Well, I don't think the 6-month jail term is a good idea. Like you said, our correctional centers are overcrowded already. I think one thing we can do is to have public health marshals. Sometimes you don't have to apply force for people to do things. Sometimes you have to help them as well by providing those things, maybe free of charge in some places. We have to work with charity organizations. Some Nigerians cannot afford to get a mask, they cannot afford to buy hand sanitizer. That is just the bitter truth. So we have to look inward and see how even corporate bodies can also engage in their corporate social responsibility. And we have to provide those things for public use as well. We have to have stations where we have hand sanitizers. And for those that cannot afford their masks, we should also provide masks for them free of charge.
Now, talk to us from where you are in the UK, what were the measures put in place by the government to ensure that it curbed the spread of community spread, rather?
Right. At the moment, we are currently on a lockdown, so it's only essential shops that are open. And but we also realize that it's not everyone that could wear a mask as well. We just have to also remember that some people just have to wear face shields. Some people who do experience breathing difficulties cannot wear masks. But in our public centers, we have hand sanitizer stationed everywhere. So before you go into a shop, use your hand sanitizer. So it helps it helps with reducing infection, the rate of contracting the virus. Because if your hands are dirty and you're touching every food produce, anyone else could still touch the same thing. So you sanitize your hand before you go into the shop, and when you're coming out, you can also sanitize your hands. And for those that don't have face masks, they are not allowed in. And sometimes we also provide face masks. So the government has done a lot, and even for small businesses that have to close down, they have also given them incentives. So this is just a kind of thing. You don't just have to tell people, arrest them in Nigeria or tell them to wear a mask or stay at home. People have to come out and look for food. They have to come out and do their businesses. So if the Nigerian government cannot provide incentives, they cannot help small businesses or people that are struggling, they don't have any income support for the unemployed, you just have to help them by providing those preventive measures for them. We just have to provide the masks for them as well, because if you're not giving them any income support, then how then can they feed their families? So the UK government is doing a lot. We provide income support for the unemployed. We do a lot, and we also help small-scale businesses as well. And we also provide all those hand sanitizers and masks as well for people that cannot afford them. So we just have to think of a way of adapting this method to suit our Nigerian environment as well.
Now, with the attitude that we have seen from a lot of persons with regards to the safety protocols, there are concerns from experts, especially with the fact that Nigeria is expecting vaccines, perhaps by the end of this month, that is AstraZeneca. And there are concerns that we might be seeing vaccine hesitancy and even refusal by some persons because of the stories we are seeing around. What measures can the government now begin to put in place, talking about the Nigerian government now, to perhaps begin to help change the minds of people towards vaccination?
Again, it's public health education. I've had my own COVID-19 vaccination, and I have to educate the public. I even have to tell the nurses to make a video to even encourage other Black people in the UK, because it's not only in Nigeria that people are rejecting, having the COVID-19 vaccine. Even in the UK, some Black people don't want to have, some Afro-Caribbean ethnic regions, ethnic people, they don't want to have the vaccine as well. So it's about education, and the government has to do more by promoting this vaccination program. Just by showing people that it's harmless. And just like I did, I had to show my own vaccination to the general public, so people that get vaccinated can show people, oh, I've done my vaccination and I'm still well and okay, and other people can be encouraged to do the same thing. So it's just a matter of having public health officers in every town, in every locality. We should have volunteers as well. So we don't have to expect the government to do everything. All healthcare workers and everyone should work together to make sure the vaccination program in Nigeria is successful. So all hands have to be on deck, and we need to incorporate the expertise of different healthcare professionals this time around, because we don't have enough doctors. So all the nurses, all the pharmacists, and everybody, we have to put our hands together to help educate the Nigerian public about the COVID-19 vaccination program.
Well, it's good to know that you have received the vaccine and you are saying that you are fine, nothing has changed, because if you look at the videos, some of the videos making the rounds, a lot of persons are afraid that there might be changes and so many things happening to them. And you also recall that the vaccine that South Africa received, which is also one of the vaccines we're expecting, talking about the AstraZeneca as well, about 2,000 persons were vaccinated, but it said the the government said they were disappointed by the results that they were getting. And that is the question again. Should Nigeria still go ahead to purchase this vaccination, seeing the results that the South Africa is getting?
Well, vaccination program, we have 2 doses. So you have the first dose, and in the UK, we've extended the second dose to 12 weeks so that we can build a lot of herd immunity before we have the second dose. I don't know exactly what South Africa is experiencing, but at the moment, the AstraZeneca vaccine, because of the storage, because of the way the vaccine is stored and the temperature recommendation, it is suitable for the Nigerian environment more than the Pfizer vaccine. And I think the Nigerian government should go ahead and purchase this vaccine for use for Nigerians. It's highly important we build that herd immunity. But on the other hand, we still have to engage in preventive measures. I've had my vaccine, but I still wear my mask outdoors. I still practice social distancing when I'm outdoors, and I use my hand sanitizer and I wash my hands frequently. So we should also remember that having the vaccine does not replace the need to do all those preventive measures, because we're trying to build a herd immunity. And Nigerian government, I think, should go ahead and purchase the vaccine. Yeah.
Speaking about herd immunity, the questions have come up with regards to how effective it is at flattening the curve with regards to the pandemic, because we keep seeing mutant strains come up over time. And we are also, Nigeria is looking at vaccinating about 45% of the population, perhaps by the end of this year. How effective is herd immunity going to be at flattening the curve, as well as we see mutant strains now?
Yes, herd immunity, in addition to imbibing all the preventive measures, will definitely help to flatten the curve. Preventive measures is so very important. Sometimes we tend to neglect it. I must say that for the last 12 months, I've been wearing my mask. I've not had a flu, I've not had a sore throat, I've not had a cough. So I can tell you that wearing your mask does prevent you from getting the coronavirus, and it does prevent other viral infections, other viral things like cough, the common cold and the common cough. Because I've not had this for the last 12 months, and I normally have cough and cold because I work in an environment where I see patients. I normally have it, more often, throughout the year. But since the last 12 months, it's like magic. I've been having my vitamin C, my vitamin D supplements, and I've been wearing my mask, and I've not had it. So I'm encouraging everyone, having the vaccination and doing the preventive measures, I think will indeed help flatten the curve and build more herd immunity in Nigeria.
Now back to the issue of mutant strains and vaccines, which a lot of persons have come up with, because we do not have as much data with regards to what we are seeing, the changes we are seeing in terms of the mutant strain, as well as the vaccines. There are concerns that the vaccines that we have currently may not be able to address the mutant strains that we see coming up over time. Do you have concerns with regards to that?
Well, at the moment, we just have to make do with the available vaccine that we have. Remember, it takes some time to manufacture these vaccines. And Nigerians, I don't think we participated in the clinical trials. And this is a time for us to start thinking about doing our own vaccines in the future. And so at the moment, we haven't got any choice than to make use of the available vaccine. So there's nothing we can do about it. Like I said, we must practice the preventive measures in addition to having the current vaccines that we have at the moment. That is just what we can do.
Talking about homegrown solutions, because you talked about how the fact that Nigeria needs to begin to look at creating its own vaccines. We've been seeing vaccine nationalism, where first world countries are thinking about themselves first, and because they have put in so much money to ensure that a vaccine comes out in the first place. As it stands now, some have even said that perhaps African countries need to come together and come up with some vaccine or solution if Nigeria cannot stand and do this alone.
Yeah, I think so. We have to collaborate with other African countries. We can start from West Africa before we spread out to other African countries. But at the moment, the healthcare system in Nigeria is nothing to write home about. So it's not just about vaccines only. We have malaria on the other side. People still die from malaria. Malaria is it's a disease that can be prevented, but people still die from malaria, which is really very bad. So we have a lot of things to do, when it comes to the healthcare sector in Nigeria. It's not actually working, to be honest. For the common man, I mean, when you have emergency, you don't, and they take you to the hospital, they ask you to bring a deposit. So, and when you have a gunshot wound, nobody wants to treat you. So we have so many issues to deal with. So in the future, I would like to see in Nigeria where we can manufacture our own vaccines. But also, before we can get to that stage, I think we need to try and fix our healthcare system. That is so very important. Because if we do not fix our health system and we're trying to go into vaccine production and other things, it will still crumble because we may not have adequate facilities to even store the vaccines in different states of the country, and we may not have trained personnel to be able to effectively provide a vaccination program. So, like here in the UK, we are working together. We have a team approach. We have nurses, we have pharmacists, we have doctors working together. At the moment, that kind of system, that kind of integrated healthcare is lacking in Nigeria as I talk. It is lacking in Nigeria. So we have to try to, work together. We have to try to practice integrated healthcare even before we can think about going into vaccine production. So it's so very important we try to fix the healthcare system in Nigeria because at the moment, it's not working.
All right, Adaku, one more question that I would like for you to touch on is still on perhaps you educating Nigerians ahead of the vaccine, since seeing that you have received the vaccine. Just give us a few words of perhaps educating Nigerians moving forward before we let you go.
Right. So about the COVID-19 vaccine, I mean, it's just like every other vaccine. I had the vaccine on my upper arm, my left arm. So if you're right-handed, it's best to have it on your left hand because after a few days, you can have some aches and pains around this area, so you may not be able to use your hand comfortably. So I had the aches and pains, and after a few days, I had some paracetamol, and it was okay. And before you have the vaccine, you would have to tell the nurse or whoever is giving you the vaccine about your allergy history. So if you've had allergic reactions to vaccines in the past or any medicinal products, you have to know about it. And also, pregnant women at the moment, I don't think they're having the vaccine because the vaccine has not been tested in pregnant women yet. So you have to have that conversation with your doctor as well. And also, if you have other comorbidities or if you suffer other diseases as well, you have to let your doctor know about it. So there are several questions, like a screening question that we need to go through to find out whether the vaccine is suitable for you. So I don't want Nigerians to be afraid of having the vaccine. It's not a chip or anything. It's just a medicinal product. And the COVID-19 vaccine is to help prevent you from contracting the virus. So
Right.
if you're offered the vaccine, please go ahead by all means and take the vaccine. I'm here, I've had mine. I'm waiting for the second dose and
All
I'm
right.
well. I don't have any issues. So do have the vaccine when it's offered to you.
All right, thank you for allaying the fears of a lot of Nigerians. Clinical pharmacist Adakwe Furube, thank you for your time on the program.
You're welcome.